Welcome back to the Soft Tissue Revolution podcast version 2.0, where we teach manual therapists a new treatment system that does focus on working smarter, not harder, which will allow you to cut your treatment times by at least 50% so you can stay healthy and help a hell of a lot more people get out of pain. My name is Dr. Matt Maggio. Thanks so much for stopping by and checking out the show. Now, last week, I went on quite a rant about how dumb it is to show a client how to treat or release their own damn injury. Now that I calmed down a bit, I decided to help teach you something this week. So what to do when a client doesn't believe treatment is helping or even working. I had two of these this week, and I thought it'd be a good opportunity to share what went wrong and how to handle when all of this happens. They both said the same line to me, and I asked how their injury and pain was going. They said kind of like in a backhanded way, it's about the same. Yeah, there you go, just about the same. My go-to response anytime I hear about the same is I go, oh, you mean you want it gone, all gone by now? I kind of laugh, ha 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 ha, but it's something that you need to confront because they're trying to give you cues that they don't think things are working. And they'll say things like that, like about the same, or it's plateauing, or not any better. And they say it a bunch of times. My rule is if they say it once, I kind of let it go. But if they say it multiple times, you do need to address it. And a lot of times those people are just being irrational. They're being emotional. There's a lot of things going on, but recognizing when it happens is really important to helping them see this process all the way through and getting the treatment that they actually need. So just a quick point of context to understand all this. I talk about this all the time, about the importance of accountability and getting the client to commit to the process by paying for multiple treatments up front. I've talked about that in several episodes. So I don't get a lot of these like treatments not working, I'm not any better, because I have a good runway to improve the situation. You know, so many treatments and systems are just focused on like trying to hit a home run on the first visit, trying to get them symptomatically better right away. But if you can't improve function and you don't have time to go, I always say treatment's like a medication. You want to give enough to be effective, but you also want to give the right amount of dosage. So that's why I have them commit to multiple treatments up front. We have them start with 12, and then we go down to 8, and then we go down to 6. We never do like a one-off visit. I've talked about this in past podcasts on my YouTube channel, like why one-off visits are actually bad for your client, bad for you as well. So a lot of this I do just helps the client see it all the way through, but also helps me be better focused as a practitioner of trying to do the right amount of treatment, not doing too much, because we all fuck up and we all think that treatment can only go two ways. It can either make things better or it won't do anything. We never consider when we're doing a million goddamn things, you know, cupping, stretching, lymphatic, whatever the fuck you're doing, and all sorts of shit and corrective exercises and all that. We never think, oh, maybe I'm doing too much shit and it can cause a problem. Yeah, I don't want to get too ranty on that. I'll cover this in some future episodes as we go through. So in my system, in my clinic, in my office, as I said before, I am still full-time in my office. I am not some bullshit guru just going online teaching people how to do an outdated system. I'm in the real shit. I deal with clients every week. I see multiple clients in my own location. So I have a process in my system called the PEAK method that I call win the room. And I teach it in the trainings, and it needs to be done on every single visit after the initial evaluation. You know, the initial evaluation is where we go through and do like what's called a functional exam, report of findings, what's going on. But then after that, each visit kind of builds up in itself. So it's very detailed, very focused. So here's how it goes. Come into the room. I don't say, hey, Matt, how you doing? I say, hey, Matt, how is the area that we're treating doing since last visit? None of that small talk of like, hey, how's it going? Because it can waste time. And it's like, it's not something serious. It just shows that you're a novice when you're just like, hey, how you doing today? And they're like, hey, I'm doing good. Hey, you know, better than average. And, you know, can't complain. Da, 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 da. Like, I ain't got time for that shit. I'm here solving problems. I'm seeing clients every 15 minutes. I can't lose that 3 or 4 minutes of just bullshit, small talk. And honestly, people that do small talk and bullshit, Nobody takes you seriously. Like, I'm just like, shut the fuck up and let's get into it and let's do the things we need to do. Then I ask them, what has the pain felt like? I always want like some type of quality. Is it sharp, aching, numb, tingling, burning, throbbing, stabbing, annoying? And then how intense? I always have an intensity scale. I say 0, no pain, 10, you wouldn't cut it off. Gives a better idea and better context of what's going on. Then usually I ask them the question of, what have you been doing since the last visit? Because a lot of clients don't understand all the dumb shit they do in between the visit is actually messing the problem up more than anything. But it's a lot easier for them to say to you, oh, treatment's not working, blame you for making it worse, being delusional that they're fat shit and they don't exercise or move, anything like that. It's a lot easier to blame you. That's victimhood, all that shit. I won't go into it too much here because I could go on forever about victimhood and what's going on in our world. But they don't think anything they did could actually cause that. They come to you and they say, here's my problem. You put it out. I'm not going to do anything to help. So then at that point, this is a really good chance. Next is I educate them on not doing dumb shit and why said dumb shit is causing their problem. And they're like, yeah. I'd be like, hey, remember that you got that bad cartilage in your shoulder? We're working all the scar tissue and we're healing it up and there's a lot of inflammation in there, but you decided you wanted to do like 1,000 pull-ups and then swim 10 miles. Like, can't do that shit with what you got. But let's check the test and see how it goes. So then I go right into my functional based tests. Yes, I like functional based tests. I don't like subjective. Functional based tests give me real data about what's going on. I don't give a shit how it feels. I care how it's functioning, because function is important and you have to improve function in order for symptoms to get better. Then, based off that functional test and those functional test findings, I go into a detailed and focused palpation where I can identify the structures that are limiting the motion. Basically, I talk about scar tissue building up in the muscles, in the fascia, in the nerves, and around the ligaments. We go over all this in my detailed courses. So you can actually have a plan about what's going on each visit and not be stuck just winging it and trying to figure some shit out. They're like, oh, it hurts here in my shoulder blade. Let me just jam a fucking elbow in there and see what happens. Nope. We're going to critically think, use our brains, be smarter. Then I do the treatment, which I'd say usually lasts around 3 to 5 minutes. And during that treatment, I'm pointing out what I'm feeling. I'm like, hey, feel that area? That's really stuck. That nerve is glued to that scar tissue, has a lot of tension in it. What I'm doing is getting the right amount of depth, the right amount of tension, having you go through a full range of motion. That's breaking down that scar tissue. We're getting blood flow in there. We're getting the bad stuff out. I'm always educating. I'm not just sitting there silently, just doing nothing. I'm telling them what's going on. And they're like, oh yeah, you're right. I do feel that there. Yeah, no shit. There's where the problem is. I'm a fucking expert. I'm finding your problem. Then when I'm done with that treatment, I go in and I recheck the test I just did to see if it's better. Because once again, you need real data every time, not just like, hey, how does it feel? It's like, no, hey man, we're here, now you're here. I got real fucking data. Hey, this is cool. This is doing really well. Then I do something really good. I let them know, wow, that's a big change. And I show them with a video or a photo compared to where they were the visit before or their initial. I'm like, man, this is going really well. And then you know what I say next? I say, treatment's working. Yeah, they have to be reminded that treatment is in fact working. And I say it with so much pride and so much, I don't even know what word I'm thinking of, but just so proud. I'm like, treatment is working. They're like, you know what? Shit, treatment is working. Look how much better I am. Then, lastly, I do a wrap up. I call it my 1-minute close. Basically, I go in and I say, here's what we did today. What you should expect. Hey, maybe you're going to be a little bit sore. Maybe going to get some new range of motion. Maybe some more inflammation. But most importantly, I tell them what they need to do in between the visit and what they need to not do to allow for this problem to actually heal and get better. Now, I know that might seem like a lot, but all of that gets done in the 15-minute treatment time. Because remember, doing that whole work smarter, not harder thing. This is what I teach. It's a system. It's not some random technique like, oh, it hurts here, do this. It's like, use the process, collect data, get functional evaluations, detailed palpation, do the treatment, show them that it's working, and then tell them what to do in between. You have a plan every single time. You're not stuck winging it and just throwing random shit on there and not really know what's happening. You don't need to be like that. You can be better. You need to be an expert. So back to those 2 clients that I talked about this week and how I messed up the situations. First is going back and looking at the previous notes. I was not following the win the room every visit. I was probably following it, I'd say like 80% of the time. Yeah, I get it. I'm a fucking hypocrite. Like, here I am telling you to do it every time and I didn't do it myself. And it came back to bite me in the ass because it's like, it's super boring shit. It's really boring to do the same goddamn thing like every visit, but boring, it was like what keeps you on a straight path, keeps you functioning where you need to be. I fucked up and didn't follow my own process. So I am in fact a hypocrite, but that's okay. Number 2 is I just pussyfooted around their load management. This whole idea of like, they were just doing way too much. These people, they were a little bit younger. They wanted to work out and do all this stuff, but they both had really bad lumbar disc injuries. They could barely walk when they came in. And I was kind of pussyfooting around instead of being like definitive. You know, it's like, never be wishy-washy. It's like, nope, I need you to do this and I need you to stop doing that. Like, think of like when you go to a doctor and they give you a prescription. They're like, hey, what do you want to do? They're like, nope, you need to do this. You need to do that. Like, don't pussyfoot around it. I did that as well. I let them do too much thinking that they were going to get frustrated and all that. And then they end up just fucking things up. And then what do? They blame me because I'm the issue, because I'm not helping them, because they're getting the treatment, but they don't feel any better. I always say an injury is like this idea of like load versus capacity. Load is what you do. Capacity is what you can take. We're fixing their capacity. If they're doing too much fucking load, it's not going to get any better. It'd be like somebody going to the dentist and complaining that they always get a bunch of cavities, but they're not willing to brush and floss and they eat a shit ton of sugar in between. That's what happens when you do not manage load. Number 3 is I didn't recognize the signs earlier on. There was a couple times where they did ask me about other treatments to help speed it up. I kind of just brushed it off. They're like, well, what do you think of cupping? What do you think of stem cells? What do you think of this? And I just was like, well, this shit don't fucking work. You know, like it doesn't, I think they're fine as like maintenance, but they're not actually fixing the problem directly. So I was just like, it doesn't, whatever. Like, no, you're not going to be able to like cup your way out of all this scar tissue. You're not going to be able to like corrective exercise yourself out of it. Kinesiotaping tape ain't going to fucking fix anything. I know if I'm saying that to you and you're listening and you're pissed off, you're like, well, cupping works. No, it doesn't. It doesn't. Hey, it's great as a like post thing to help with inflammation, but it ain't fixing the actual tissue. But I digress on that. I kind of just brushed it off when they asked those other questions in the middle of the treatment. And the other thing was they're like halfway through their treatment package. So I knew I had time. I knew I had more visits. So I was like, I'm not going to really address it. That was a big mistake. You need to address that shit right away and tell them like, here's why it's not a good idea. Here's what it actually is. I use that analogy of like, I'm the dentist going in, drilling out a cavity, all that other shit, cupping, stretching, exercises like brushing and flossing. It's super important, but right now you got the cavity, and if you go in there and brush and floss, you're just going to piss it off more and more. Analogies seem to work really well in my practice and in the client education process. Number 5 is I just didn't have enough objective data to back up the progress. I hadn't been doing as much photos and videos. So I'm like, hey, you're doing better. But I didn't actually have the data to show it. And lastly, I just took it personal. That they were saying treatment wasn't working, like it was a bash on my own ego. You know, one of my favorite books, and I forget about it all the time, is The 4 Agreements. And one of the agreements is like, don't take shit personal. And remember that we all choose to be offended. And that's what happens. I just took it personal. I was like, man, fuck these guys. Why are they being like this? But that wasn't the right way to be. I wasn't in the right mindset. So how could have I avoided all of this? Number 1 is not be a hypocrite and stick to the win the room every damn visit. Number 2 was not compromise on the load management stuff. Number 3 is check my own ego and understand I was the one that chose to take it personally and be offended. And lastly, understanding that the client doesn't need you to be their friend. They need you to be their leader and help them as a guide along the journey to getting the problem fixed. Whew. Talked a lot there. I didn't rant as much as last week, so I feel better doing this. So a couple call to actions before we finish this episode is, number one is don't forget to subscribe to our YouTube channel. That's where I go through more clinical and the treatment side of things. Number two is go grab our free training modules to get an introduction on being the best damn soft tissue practitioner in your area. Once you go through that, you can take one of our immersive CEU courses. We have those available in both neck, shoulder, thoracic spine, or low back, hamstrings, and hips. They come with CEUs, a lot of good shit in there as well. And lastly, I say this all the time, but it's very important to mention, commit to being great. It's the only thing that truly pays. Appreciate you guys listening to the episode, and we will talk to you on the next one. Bye. Thanks so much for listening. If you want help on the path to being able to double your income, all while working 50% less and being taken seriously as a healthcare provider, I have some great resources for you. Number one, get access to our free training modules and introduction to my system, the Peak Method. Number two, subscribe to our YouTube channel, The Soft Tissue Revolution. Links to all of this can be found in the show notes. Lastly, if you like the show, please leave us a 5-star review and share it with others that you know it could help.